Dr. Patricia Daly, our guest. She is Vancouver's Chief Medical Health Officer, Vancouver Coastal Health. I'm not sure exactly how that works
That's
anymore, but you're in charge.
Yes, for public health.
For public health. What got you interested in public health?
Well, I started out as an emergency physician, and I saw so many patients coming into the hospital with conditions that were preventable that I wanted to move upstream to think about prevention. And it's quite satisfying to be in that role.
I'm sure. Back to ecstasy, MDMA, made in a basement. Where?
I'm not an expert in the manufacture of ecstasy. MDMA is the ecstasy drug. So that's what people think that they're ingesting when they buy ecstasy.
The happy drug.
Yes.
And what's the other one, the PMMA?
PMMA is another substance that, and again, I'm not an expert in this, but that apparently has been contaminating some of the ecstasy available in Vancouver and in other places in Canada. The problem with it is that it may be more toxic to the brain than ecstasy. And the other problem with it being cut into ecstasy is that people may not immediately feel the effect. It may slow the effect of ecstasy, so people take more pills trying to get that ecstasy feeling, and as a result, they suffer an overdose. There are, however, many substances that can be cut into ecstasy. In Calgary, they found crystal meth, so you never know what you're getting with these illicit drugs. I think that's the warning. In the coroner in BC has said 5 of the deaths that occurred last year, they found PMMA in their system as well as ecstasy.
Really? And back to cocaine certainly can be cut with anything.
That's right. And there's also a concern with potency. The deaths we've seen, the heroin overdoses that we've seen in recent years, it may be because the drug is more potent. So there is no quality control with the illicit drugs that are available.
Safe injection sites, location, location, location.
Yes.
Do we have enough? I'm just thinking, if you want to go to a safe injection site, you're probably not going to take a taxi.
That's part of the problem with all our harm reduction services. Many of them are concentrated in the downtown east side. What intrigues me about the application from the Dr. Peter Center is that they are a facility that already provides services to drug users, and now they're just adding in supervised injection as another one of those services. And I think that's the model that we need going forward. Rather than establish further standalone sites, which can be controversial, difficult in most neighborhoods, if we can just add supervised injection to the nursing services we already offer in places where we're currently treating injection drug users, I think it will be much easier to make those services available. So primary care clinics, residential facilities that may serve drug users, if we can train our nurses in the practice of supervised injection, we can gradually expand the availability of these services to places where we're already providing care to drug users.
That's interesting. And hospitals so crowded. There's not a place in a hospital where you can have a safe injection
Well, some
site.
people would
in
argue.
most hospitals.
That's right.
It would make sense because you're right there, but when people are sleeping in the halls,
Yes.
not so good.
No, I think we need to look at where it makes most sense, starting perhaps with residential facilities, and that's the Dr. Peter Center. They have a residential facility where many of the people there living with HIV and AIDS may use injection drugs, and the nurses there can now offer this service to them, just like we now offer needle exchange at many more locations than we began with. The first big needle exchange in the downtown east side started many years ago, but now we've distributed that harm reduction service around the region. We need to do the same with supervised injection services.
And do you look over the alcohol centers or the detox centers as far as there's a suggestion if you're poor and you want alcohol and you're drinking shaving lotion or something, it would be better if you were drinking cheap scotch.
I think we need more discussion about that to determine how that might work best. All these services are controversial, and we wouldn't enter into any of them without determining first what is the need, what are the benefits, and what could the harms be.
So no policy yet?
No.
No policy yet, but you would like to see more supervised injection sites?
Yes, and in Vancouver Coastal Health, we are supporting the Dr. Peter Center, and we're developing our own guidelines for where we might look to offer those services in the future.
Okay, and how are we doing HIV prevention in this city, in the region, in the surrounding area? I know Dr. Julio Montana, rock star.
Oh, he is, and his latest initiative, the Stop HIV/AIDS, we're very involved in partnering with him on that. It's working very well. We're getting many more people tested. In fact, every adult, if you've ever been sexually active, get an HIV test this year. That's our message to you.
Okay, and you have to ask for it.
Yes.
It's not an
the
automatic
doctor
test.
offers it to you, but it's not done without your consent.
Exactly.
Yes.
Oh, nice to see you.
Good to
Thank
see you,
Thanks
Fanny.
for taking the time out of your busy day. Dr. Patricia Daly, Chief Medical Health Officer, Vancouver Coastal Health. And coming up.